even in simple things like cleft lip surgery, when we have a cleft lip and you handle the lip of the child who is like 3 months old, both elements will swell and you will completely lose the landmark of where you should go to create these very intricate topography of the lip, where the peak of cupid bow, etc. If you have not marked the patient and tattooed the patient with ink into the dermis, you completely lose your very valuable preoperative planning. Here again, there are some like aesthetic practitioners who are very, very experienced. They don't mark. They just see, okay, I'm going to inject here and here with these volumes. I think if you are starting, you must mark, and with experience, you know that I'm going to put 0.1, as Gerardo was saying, 0.1, 0.1, etc. And then even if you have, I started being confused when I saw Fahad in 2012. I was very early in this field, and I saw him in his outpatient clinic or his procedure room doing this local anesthesia infiltration, and I saw that he corrected the deformity already with the local anesthesia. How does he go back and inject there? Because that is a fluid. It's going to go away, and only the product that you will put there is going to last and in the long term address the deformity. So you will develop, and I am advocating that from my own learning curve. I'm not, I really recommend that we avoid post-operative complications and serious ones like arterial injection. So you will develop this kind of finesse and this feedback from the tissue if you are injecting fluids like normal saline, and that is not going to kind of obliterate your judgment if you have very good preoperative planning and mapping of what you are going to do. I would like to say that my first upper lid injection was excellent, but the contralateral one, I had hematoma. And I don't know whether it's small hematoma, like maybe a lentil size. And I don't know whether the product that I was using, or the technique or the patient themselves having, it lasted for like 4 months before it kind of settled again. This kind of heaviness, asymmetry, and kind of swelling there. I don't know if you can, Fahad, share with us, in relation to the simple complications, the type of the product that you put, and how you manage these kind of soft one, not blindness, etc.
Blindness, I don't know. Maybe all the patients on whom I had hematoma on the upper lid, it was on their right eye. Why? Because I'm a left-handed. So usually we are better on one side than on the other. So when I go back to the right eye, it's more complicated for me. Number two, I have had a patient with blepharoplasty, usually takes like 1 week, 10 days, over 6 months of, but dyschromic coloration because of the incrustation of hemoglobin, etc. So I don't have an answer to that. We know that whatever we inject, when we inject in the lids, and when there is, as the skin is extremely thin, it might stay a longer time, but I don't have, how can I say, I don't have an explanation to that. I don't have.
How long a hematoma usually will last? What do you tell the patient?
Oh, you've seen, for example, when I do fat grafting, injecting 5 cc's in the upper lid, with for each cc going 60 to 100 passes, so like this. After 2-3 weeks, this is the worst. Hyaluronic acid, it's a maximum 1 week.
Excuse me. I don't know if you have now the hematoma, blue one, or a dark mark, a dark spot. because the hematoma, you have some deposit of hemoglobin, and then with the UV sun exposure, you can have some dark spot. And dark spot you have to treat with the pigmentant. I don't know the real color you have with this patient. Normally, after 2 weeks, the hematoma we don't have.
It was a palpable nodule for almost 3-4 months, and it's like a product or something organized, and then it settled, it went away. I couldn't explain it. But for a while there was a palpable nodule it was a palpable nodule, and you can notice it if the patient closed their eyes, you could see an impression of a swelling there, but it was spontaneously resolved, and I just supported the patient for the time. Okay, well, any other questions?
Ali, can I just make a comment? If you're out, just make a comment.
Oh, thank you.
Marking, you were speaking about marking. One of the earliest during my training, Professor Raines really loved it. He said there are some people who have something called the eye of the mind. They don't need to mark.
Yeah.
I'm one of those who doesn't have an eye of the mind. I always mark everything I do, even harvesting bone. I have to mark because I don't. Some people are gifted. Apparently, it's a gift. Eye of the mind. They don't need to mark. They can spot things. They can do things. So.
Yes.
But when he marked, today you opened my eyes on the valleys and the elevations. If you marked before, despite your local anesthetic swelling, you still know where you're going to inject.
Exactly.
The same thing with the noses. They say if you inject, you distort the anatomy, but you got your photographs there.
Yeah. Exactly.
That's why you need photographs and you need markings.
That's it.
So I hope it's some useful.
Thank you very much.
Exactly.
We have a question here.
Thank you.
Thanks. Just wanted to know the place now, periobital, upper and lower eyelids, and then the crow's feet. They are mainly due to, I think, the skin scaffolding get lost. So I know hyaluronic acid we can treat with that. What is the place with the PRP with microneedling and then any threads? Just can you please advise on that, please?
Any of the faculty have experience in microneedling and PRP?
Yes. What's your question?
The question is, you have addressed a little bit about laser and PRP and showed some results. What about microneedling as a resurfacing and, collagen enhancement technique?
Collagen stimulation with
Yes.
PRP and microneedling and threads. How can that improve the eye? These treatments.
Yeah. I use with my PRP. I inject subdermally, and I use also with the 32 gauge needle. I use some microneedling. Clinically, it's better, but I don't have histological response to this. But it's said that the quality of the skin is better after, and we have more collagen and better collagen.
Can I ask?
Especially when we combine with CO2 fractional laser. With CO2 fractional laser, I have the scientific proof that after biopsy, a biopsy before this one session and 6 months after one session, that the quality of the epidermis is better. The wrinkles are less deep, and the collagen is better, and the orientation of the collagen is better, and we have more elastin. So with the CO2 fractional laser, we have the proof in the lower eyelid. with biopsy. But microneedling, yes, we know that it can improve the skin quality, but we cannot promise to the patient that you will have the 100%